Hi there. My name is Kimberly Mitchell. I'm a Doctor of Medicine candidate at Queen's University in Kingston, Ontario, and I'd like to present my project on Indigenous virtual healthcare. Indigenous people in Canada have much higher rates of chronic diseases and lower access to primary healthcare providers when compared with non-Indigenous Canadians. In the literature, I found that healthcare providers and governmental organizations often touted virtually provided healthcare as the main solution to this problem. What's missing in the literature is that Indigenous people have never been asked whether virtually provided healthcare meets their needs or is a modality that they want to receive their healthcare by. A key problem in Canada is that we have a long history of several hundred years of poor relations between both the federal government and Indigenous people and researchers and Indigenous people. In the past, research has not been conducted ethically with Indigenous communities, and as a result, a number of Indigenous communities and people are very hesitant to get involved. Indigenous voices are not present in the literature, and this is really undermining the ability of Indigenous people to reconcile with non-Indigenous Canadians to improve the health care that's found in Indigenous, rural, and remote communities. When I began this project, I rigorously set some goals for myself. And my first item was to initiate and build on the relationship with a specific Indigenous community, collect their experiences, and then elevate voices. My expectations were that this plan would go fully forward and upward in a straight line as depicted. In actuality, this journey was much more back and forth. My Indigenous relationship building began early, thanks to the prior work of my principal investigator. However, my introduction to open science was much more bumpy. I really didn't think that open science applied to my work because it's not something that's really used broadly in my field. Previously, when I had been part of labs, there was a big concern about ideas getting scooped or that the idea would be published by another lab before we could publish. And so things were kept a little more private than I was used to in my past career. Along came sort of community ideation and collaboration spaces. A key component of my project is the concept that Indigenous communities can choose to maintain their own data private, not share it with researchers or anyone else. And so I initially thought that community ideation and open collaboration were really not concepts that I could incorporate in my project. And it was a real growth challenge to start working on some of these concepts and carving out how I could use them and where they could be applied. When our group held our first co-design workshop between um, the research team and the community stakeholders, who comprised a group of health directors and other senior community leaders in the region where my project will be fully deployed, the participants had a real hunger to contribute, and I credit that to the relationship that my principal investigator had built. She worked beside Indigenous organizations and was really somebody who enabled the research agenda of the community themselves. So these are projects that the community is interested to execute, and the research team are supporters in making sure that the community's priorities can be achieved. As I worked through my Open Seeds assignments, I was a little surprised at how my personal beliefs influenced my approach to visioning. And the words that I chose, I realized could actually damage relationships. And it really led me to be very thoughtful about how I worded my content that I would use in sort of open collaboration. As I touched on a little earlier, my biggest area of growth was really in community interaction. Even the phrase still scares me a little. I would say the advice I received from my mentor was of the greatest help in me getting comfortable with the issue and finding a platform that could work for us. The item that I'm working most on now is an Indigenous consent process. In Canada, traditional consent processes often develop a consent form that is a very legalistic document, and it tends to be quite long, usually in the realm of 15 to 20 plus pages. And Indigenous participants really just, it does not fit with their culture to use this method of communication. Social interactions are much more important. It's more important to sit and share a meal, for example, than it would be to make sure that a participant has had the entire consent form read to them. So I'm good at recruiting champions and aligning with goals of administrative staff. And so I am optimistic that I'll be able to develop a process that will meet the institutional needs and also the participant needs. My next steps, I am launching an open collaboration community using the SharePoint service and working through the ethics approval with my consent form. I also have a few other topics that I'm working on, and we're looking forward to scheduling interviews soon. I will be in the community in February, and I'm looking to introduce my study at that time. I'd love to stay connected with you all. I have opened a Google form where you can sign up to be notified about the collaboration community and its launch. As soon as the SharePoint page is available on the open internet, I'll notify everybody on the list. And you can either go to the link shown or you can scan the QR code to find that form. There's no pressure to sign up, and you do have the ability to modify your submission if you change your mind later. I'm also always interested to connect with people who have similar interests, either by email or on LinkedIn. And I hope that some of you will reach out and stay connected. I'd really like to acknowledge Kate and Butterfly and the staff of the Winnebago Area Health Authority. The interactions that I've had with them have really helped me build the confidence to put this work forward. Dr. Karen Yates and Dr. Sarah Funnell at Queen's University have been instrumental in helping me access funding and time, and also to help me build the skills for this work. And I'm forever grateful to the Digital Research Alliance of Canada for funding this very important work. Thank you very much, and I appreciate you learning about my project.